Your diet sounds like it's going to take quite some time.
It can take. It depends how many foods they decide to reintroduce, because, for example, if there is something that is like high FODMAP, but they were never eating it anyway, it's not worth reintroducing it and spending all that time to do it. I think approximately it takes about 3 months to do all the challenges for every single food FODMAP group that we are assessing. So it can be quite long. Any other questions? Yes.
So if they got to say week 6 or from 6 and they've been doing it really strict but didn't see any improvement, would you then discharge them back to the GP and say it's probably not food?
You may for non-responders, is that right? So I would just go back, as I mentioned, and check compliance, check that there's no room for improvement in the first line advice. So for example, they haven't started suddenly, I don't know, drinking loads and loads of tea or coffee. There's nothing else that you can improve. I would double check whether they're willing to try probiotics and use the list that Miranda and Kevin have created for you, and just suggest the appropriate one. But if nothing else helps, then yes, it might be more appropriate to just refer them back for further input from other specialists.
I think to add to that is that the dietitians often think they're going to be able to resolve that patients can present us with. And I think sometimes you have to realise that you get to a point where you can't provide anything else from a dietary perspective, and there may be other influences for that patient that's particularly important. It may be that stress has a much greater role to play for that particular patient, but it's good that they've tried diet and they've sort of come out the other side and seen whether it's an option for them. And if compliance is an issue, then that may be that they will never ever get round to following the low FODMAP diet effectively to see if it really works. You might find that lots of patients come back to see you, they say, oh, I haven't followed it, and the simple thing would be to say, go off and try it again. You do that several times, they keep coming back, they haven't tried it. You're wasting everybody's time, and you need to get down to the bottom of why they haven't tried it, what are the challenges, and ask them straight out, are they really likely to be able to do that? And if they can't, then accept that it might not be an option for them because they're not able to adhere to it at that point in time. And maybe that's an issue around motivation, and a discussion for another day. There may be other factors in their life that's influencing why they can't at that point in time. So lots of things to consider. Yeah.
I've heard quite a lot about the combination of foods. So I know that someone said to me about having avocado or sweet potato and butternut squash or onion and garlic.
Mm-hmm.
It can cause the IBS symptoms. How do you go about reintroducing them?
We usually suggest to reintroduce, so we start by reintroducing individual foods, so we can identify which food groups, which FODMAPs they can not tolerate, for example lactose or not. But if they have, they frequently have meals that are made of a combination of different products, then I would think that I would ask them to re-challenge that food as a proper single food challenge. So go through the 3-day challenge for that one. I don't know if you, Miranda, do it any other way?
Yeah, once they've been through the basic we would then say try more composite dishes, try more mixtures of different high FODMAP foods. And if they manage to tolerate a particular type of FODMAP, so say mannitol for example, they should be able to tolerate all foods that just contain mannitol. So it's about a process, a stepwise process, gradually diversifying the diet.
And it's important to understand for patients that even though we have the stage 1, stage 2, 3 as different stages, when they go to stage 3, it is likely that they go back a little bit to stage 2 to assess a product that they're not sure about and they didn't test beforehand, or they think that their tolerance changed, and then they'll go back to stage 3. So it can be, they can move back and forward a little bit if they identify that they want to test something new. Yes?
When you're doing your challenges, do you tell them just eat that, whatever it is, on its own, or can they have it like as part of, say, like if they're making a meal or something?
I would usually tell them to have it as they normally would have it. So if, for example, they have an apple on their own, perhaps that would be an option. However, it may be the case that if they have it with food, perhaps it may be better tolerated. So it really depends on how the patient prefers to eat it, I think, and just go with that choice. Anything different from you?
I think that's
Yeah. So it's just doing what they would normally do, because we want to assess the impact that would have in their normal life. So we would go with whatever they feel it's their normal.
If they say get to, I don't know, day 2 tolerating, say, the onion, but then they get to day 3 and get the symptoms, would you ever say to them, it may be that you can tolerate a little bit of onion in onion powder, that would be fine, but if you kind of go too far, is that okay to say to them?
It is one reason why we do the reintroduction in three different days. It is to see whether there is a dose response of the FODMAPs to the symptoms. So yeah, if they only react on day 3, then that means that small portions of onion and garlic, or garlic, whatever that food is, can be tolerated. But they need to be careful, because if they have up to the tolerance, then we know that causes symptoms.
In terms of reintroducing foods, is there any difference in tolerance between raw versus cooked fruits and vegetables?
I'm sorry,
Raw versus cooked?
I'm not sure there is. We don't have this evidence, definitely not published. In terms of experience, I don't have any on my own.
for beans and pulses. So, for example, they seem to be quite low in GOS if they're tinned, but if they're dried, they're much higher. So it's better to advise for people to have tinned varieties, and the same would go for lentils as well. So there are some differences between foods where it's been measured, but it's not being measured in every different food, and you'll find that different types of onion might have a different level as well, depending on where they're grown. So there are minor differences between one food and the next.